Have you ever wondered how anxiety is diagnosed? One such tool that we use in Ontario is called a Generalized Anxiety Disorder Assessment, called a GAD-7, to determine the severity of your anxiety disorder. The GAD-7 consists of 7 questions, and the score is calculated by assigning scores of 0, 1, 2, or 3 to the response categories of not at all, several days, and more than half the days, and nearly every day, respectively, and adding together the scores for the 7 questions. Now, in isolation, you may feel like you suffer from one of these kind of complaints, but having them together and having certain scores is what we use to help us rate. A score of 10 or greater represents a reasonable cutoff point for identifying cases of generalized anxiety disorder. So if you've had the diagnosis, your doctors who've worked with you, we have multiple treatment options. We always start off by getting you to learn more about anxiety, do some mindfulness, relaxation techniques, exercise, cognitive therapy, support groups. We want to get you involved and knowledgeable about your condition. Then we often look at medications, and there's a number of different medications we use, but there's 2 classes of medications that are often used. And this will be your SSRIs or your SNRIs. So these medications are classified as antidepressants, but there's a big overlap between anxiety and depression. So often you suffer from anxiety, it's not in isolation. In most cases, you'll also have an element of depression. And we also will screen you for depression using a different score, but very similar to the GAD-7.